early, but certainly noteworthy is Serenity Women's Health and Med Spa. You opened that, as you mentioned at the very beginning, in the middle of the pandemic. What sparked you to open this practice at this time? And share with us the challenges. I'm sure there were some, but also the rewards that you've had in opening this new practice.
Yeah, so it's definitely something that I've always wanted to do. I wanted to create that safe space for women to be able to come and, get that compassionate care that we all deserve. And also to have in that same setting, a med spa where you can, indulge in self-care, get a facial, get a pap smear, get your mammogram order, all in the same space, right? And so a lot of women, don't like going to the gynecologist, and they don't like going in for their annuals or their pap smears. It can be somewhat, of an invasive exam. Well, it is an invasive exam. And, so this was something that I thought would help to bring more, and I thought about this in residency, actually medical school, that this would bring more people into the doctor if it's not really set up just like your typical clinic, that it was very relaxing. Like we have aromatherapy in the office, and it doesn't look like your typical office when you come in. And the fact that you can come in there and get all these other services or massages and things like that, just to kind of incentivize getting your wellness, prioritizing your wellness and your self-care as well, which is important. So that's why we wanted to do it, my partner and I. And the reason why it happened during the pandemic was because that was our goal, to open it that year, regardless of the pandemic. The pandemic happening really made it more, it really highlighted more of a need for this. And so patients were really looking for physicians of color. And my partner and I were both that. They were looking for a place where they could get, all of those different services in one place. Plus, in Pearland, there really wasn't enough, even though it's a diverse community, there wasn't enough practices that was able to provide what we were trying to provide. So for all those different reasons, we wanted to open regardless of the pandemic. And we were in somewhat of a recession-proof field. I mean, people are still having babies. And, we were like, let's take this leap of faith. We're going to open it anyway during the pandemic. And we really still felt there was a need. I mean, the need didn't go away. So that's why we decided to do it. Now, as far as challenges, it was extremely challenging. When it comes to banks, when it comes to loans, when it comes to things from that nature, nobody wants to fund a startup private practice from two young physicians in the middle of a pandemic when other offices were closing their business, they were closing their doors. So it was difficult to find somebody that truly believed in our business plan, our model, and somebody who really, trusted us. But we were able to find that and secure a place. And we navigated past those obstacles together, and we were able to open within 6 months.
Well, congratulations on that. I've always thought about the fact that place matters and the physical plant matters, right? And so it's not that you have to have a lot of bells and whistles, but I believe that the space that we care for our patients in should be respectful of our patients, right? Mm-hmm. And you should be able to go to a respectful place no matter your income. What have you heard from your patients across all of the perhaps income spectrums that we've chatted about today?
Our feedback has been wonderful. Like, our patients love it. They love coming to the office. And that was the whole point, was we want you to come, we want you to feel empowered. If you have a question, you shouldn't be embarrassed. You shouldn't feel ashamed if you are having infertility issues, if you're having, some type of vaginal issues, that you should be able to feel comfortable to come to the doctor and to have a doctor that's going to assess the issue and to treat it.
Well, Dr. Cross, I can say it's been an honor to speak with you again. Thank you for everything that you've done to promote women's health in communities of color. Before we log off, is there anything you'd like to say about your hopes for your work, this new practice, this new venture, or medicine in general, going forward, what do we all need to do? And I say all purposefully, to make health and healthcare more equitable and accessible for all.
Yeah. So like as far as like future works and plans to move in that direction, so I recently actually started a nonprofit called What a Doctor Looks Like. And what I really plan to do with that is really starting a lot of different mentorship programs, scholarships, and things of that nature to be able to get more minorities and pulling our youth from different inner city areas and underserved communities to be able to get to the medical fields and the STEM fields, because I do think more of that is needed. And there's different programs that are out there, but sometimes, they have a 5-day program, 10-day program. And really, when it comes to mentorship, when it comes to things like that, it's not 5 days, it's not 10 days, it's a lifelong experience. And so really being able to foster those relationships and to carry, our youth from first grade all the way into, matriculating into medical school and further, I think is really, really important. And so that's something that I'm really focusing a lot of time and attention to. And so I definitely would encourage everyone to get involved with different local nonprofits or different programs that are doing that, because at the end of the day, that's what we all deserve, that equitable healthcare. And the only way we're going to see change is if we're all working together to be able to provide that for the entire community.
Thank you so very much. An honor to be with you and an honor to be able to feature you here at Everyday Health. I look forward to seeing what your work brings. It will certainly bring a lot of rewards to us all.
Thank you so much for having me again.